Hi, it's me, Caloris. I'll be removing and applying a dry dressing. So, okay, we'll go ahead and get started. I've provided privacy for my patient. I'm going to introduce myself. Hi, I'm Caloris. I'm your nurse today. Um, Now I'm going to go ahead and apply hand sanitizer. Okay. Could you give me your name and date of birth? Okay. Have any allergies? You having any pain? Okay. Well, what I'm going to do is I have an order from the doctor, and I'm going to take off your old dressing. I'm going to apply your new dressing. Okay. So I have gathered up my supplies here. I've got my trash bag here. Let's see what else. Then I'm going to go ahead. I'm going to adjust the height of the bed to a comfortable position. I'm going to go ahead and put an absorbent pad underneath the wound. Get my patient nice and comfortable. Okay, so we got the absorbent pad there. I'm going to go ahead and I'm going to apply my clean gloves. Okay, so we have the gloves on. And what I'm going to do, we'll start at the corner. We'll do a corner at a time. We'll lift up the corner and we're going to remove the dressing. Area, okay. So got the dressing, all right. I'm going to take this out and I'm checking the drainage. Okay, so then we'll go ahead and dispose of that. All right. While I have it out, I'm assessing the wound. I'm looking at the color. I'm checking it for any odor, any drainage. It's also, a good time if you'd like to go ahead and you can measure it now. Okay. And then if we needed to get the depth, you can do that as well. Okay. So this is what we've done so far. We've checked the color, we've checked the odor, we've checked assessed for drainage, and we've measured it. So now I'm going to remove my gloves. Put that in the container. I'm going to perform hand hygiene. Okay. So now we're going to go ahead and prepare a sterile field. So I'm going to open up my kit, open it up away from me. Okay. Got these corners. And so we'll put that down. Okay, put this so you can see it. And what we want this 1 inch here. I'm going to go ahead and put on my gloves. This one. Take it by the cuff. Then we'll get this side by the cuff. Okay. And then we'll get rid of this here. Okay. Now I can go ahead and take the things out since I'm sterile. So we have my ABD pad. I have goals, and we want to keep that 1 inch border. I have tape. Okay. I I am gonna go ahead and pour the saline into my basin. Okay, so now we're gonna go ahead and start with cleaning the wound. So I'm just gonna go right ahead. Take the saline and we're gonna dip it in there. And what I'm doing, I'm gonna start at the center of the wound out. And we're doing one wipe and then we're disposing. Again, we got that, put it in the saline and wipe it. Okay. We want to blot it dry. All right. So then, now that I've done that, I'm going to remove my gloves. I'm going to perform hand sanitizer. I'm going to apply a second set of gloves. And you want them to be sterile gloves. So that's what I'm doing here. So I got a second set of sterile gloves. And what we're going to do, we're going to go ahead, I'm placing, well, okay, I'm getting ahead of myself. Some people take the, like if you have a cream border, you can put around there, like a skin protectant. So we have this. Now that everything is good and dry, I can go ahead and put the skin border around. And you want a different one each time you do it, because you're going to dispose that one. I'm going to go ahead and we'll put the gauze in there for the wound. I have my abdominal pad that I'm putting on my patient. Okay, and I'm reaching around on my border because you don't want to directly reach over it. And then we'll go ahead and we'll apply we'll tape the corners up here. So we'll apply the tape. So what I've done is I did the tape like a little border here. And then you can even use the tape, get you an ink pen, and go ahead and label it with the date and the time and your initials on there. I'm not going to use this anymore, so then I would just go ahead and dispose of it. I'm going to go ahead, remove my gloves. Then I want to apply hand sanitizer. So position my client, get this from underneath of her, get, clean up all of my linen, get my patient comfortable, adjust the bed back down to the low position, make sure she has her call bell, and then that concludes, that concludes this, and then I would go ahead and document. Thank you.